Hi, my name is Paul Helland. I'm one of the anesthesia residents here at UCLA Medical Center. And today I wanted to talk about how to excel on your anesthesia rotation and your sub-I, talking about some of the soft skills associated with being a successful medical student and resident. Since this is a question that we get quite often, I think it would be useful to hear this stuff early on. That way you can apply it if you choose to your upcoming rotation and hopefully get the most out of it that you can. The outline of this talk is going to cover some acknowledgments, a couple caveats given the subjective nature of this topic. I'm going to discuss how to prepare for a case and what resources you could potentially use. I'm going to discuss briefly some communication skills and the other soft skills necessary to make a good impression. And then we're going to use an example of what I call a day in the life of a medical student as we walk through the hospital, demonstrating all the opportunities you can to excel and apply these soft skills. I'm going to summarize some of the characteristics of what I consider to be a solid medical student and those medical students that have made an impression on me in a positive fashion. We're going to go over briefly a system for receiving feedback professionally, which I don't think is taught in medical school. And then some conclusions. Just a few acknowledgments before we get started. The first of which would be Dr. Dustin Williams, a name that might look familiar to you. He's the physician that runs the online MedEd website. He was the first person to introduce to me the analogy of emotional currency, and it was something that I felt like I was already applying, but it makes for a good description. Jordan Peterson is an author of a book called 12 Rules for Life. We'll talk about how he emphasized the need to establish your posture like that of a lobster. Dale Carnegie, the author of a very famous book called How to Win Friends and Influence People, who's been providing rules for friendship since 1930s. Dr. Austin Backus, who's my original physician mentor, who taught me not only how to be a compassionate physician, but an excellent colleague. And of course, all of the janitors, security guards, fellow nurses, friends, nurses' aides, scrub techs, nurses, anesthesia techs, doctors, residents, volunteers, and all the bosses I've ever had that really shaped me into who I am as a person. So thank all of you. Okay, a couple caveats before we get started. This is a very subjective lecture compared to some of the other science-oriented videos that I've made. There's a lot of people who will watch this and say, man, I already do all that stuff on a daily basis. However, you don't have to spend much time in the hospital on any particular unit to understand that the common sense isn't so common after all. Once again, very subjective based on my own life experience, my own education, my own impression of working with dozens of medical students. That's that. Okay, so for students starting in anesthesia, oftentimes they're not quite sure how to prepare for a case. This deviates a lot from the internal medicine style of rounding and presenting, and rightfully so. Our specialty has different nuances that are important to take into consideration. I've made a video that describes how to pre-op and what you're looking for, as well as giving a template to help you extract and keep that data organized during your pre-oping. So I would refer you to this link here. And then when talking about creating an anesthetic plan, it's useful to think about terms of pre-op, intra-op, and post-op. And from that aforementioned template, I've listed a breakdown of that with some details under each of those three headings that will help you remember what it is that you might want to include in your plan. The specifics of the type of surgery and the anesthetic implications thereof, I think, is one of the main things that overwhelm students. If you're having somebody that has a thyroid surgery, well, number one, how the heck do you take a thyroid out? What's involved in that? What's the patient positioning? Is there anything weird that happens during that particular surgery? And in addition, what are the anesthetic implications of that? There's a fantastic textbook out here, really just a classic of anesthesia. It's called the Anesthesiologist's Manual of Surgical Procedures, and it's affectionately known as Jaffe after the lead author. This is a crucial textbook that is co-written by surgeons and anesthesiologists. So if you happen to look up, say, that thyroid, you'll have an endocrine surgeon describe who gets a thyroidectomy, the reasons for it, the surgical steps involved, the outcome, the potential side effects to anticipate. And then the second half is written by an anesthesiologist who will talk about the anesthetic implications. And it's very useful when you're helping craft a plan, especially early on. Of course, Basic Miller and Morgan and McHale are great resources as well to help familiarize yourself with certain drugs that you might want to anticipate using if you're not familiar with them, or different types of equipment that you might extract from the recommendations of Jaffe. One thing I want to put out is to not be afraid to try. The nice part about anesthesia is when you're creating a plan, just put something out there. Just say, you know what, this is what I want to do for this ASA class 3 female. I want to do general anesthetic. I want to give some midazolam preoperatively. I want to get a couple of PIVs. I want to put a tube in, and really just take ownership of whatever it is that you decided for that patient. And it's completely okay to be completely wrong. I think it's awesome when medical students just say with confidence whatever it is they want to do. It really demonstrates a desire to, number one, want to learn, but to attempt to establish independence in their thought process. So I would highly encourage you to utilize these resources with this template and just take ownership of it. Who cares if you're right or wrong? It will only allow us to help teach you. One other thing I wanted to mention, since we usually prepare the night before, the clever medical students, when trying to figure out when to get to the hospital, phrase the question, hey, what time do you usually get to the hospital, as opposed to what time do you want me to get there? And I like this way of doing things because if I say I'm getting there at 6:30, the medical students that stick out in my mind have gotten there at 6:15 and they're already there attempting to set the room up. And that makes a huge impression on me, as opposed to the students that come in at like 7:15 when the room's already set up, patient's been consented. So think about asking this question when you're trying to figure out when you should get to the hospital, and get there 15 minutes early. All right, let's talk about communication and some of the soft skills associated with being an excellent medical student and person in general. One thing I want you to always be aware of when you're walking to the hospital is your nonverbal communication. Even if you're just chilling or you're walking by people, I would encourage you to do two things. Number one, smile. It's very sad when I walk to the hospital and I just see people with their head down, kind of slumped over day in, day out, and they never look up, never smile at people. People respond exceptional to a bright smile. So it's something that I don't think should be overlooked. In addition, Jordan Peterson talked about ad nauseum in the first chapter of his book, 12 Rules to Live By, the need to always, stand with good posture, with your shoulders back, and give the impression that you're confident in what it is that you're doing. And he goes into this really interesting history and the evolutionary development of the lobsters and their postures and being a successful mate and whatnot, ending with the recommendation that we stand up straight with our shoulders back. And I agree with that. You don't want to be one of those people that are just kind of slumped over, just slugging their way through the hospital. Patients, I think, can detect how confident the clinician is based a lot on their nonverbal communication. Never forget to introduce yourself. And this is especially true of interprofessional communication. I'll give you an example of something that I see quite often in the hospital, such as when a medical student or a resident walks up to a nurse who's obviously in the middle of something, and they say, "Hey, are you the nurse for Smith?" And the nurse looks up and says, "Yes." And the resident says, "Oh yeah, well, how do you do overnight?" And the nurse answers, and then he says, "Okay," maybe says thank you, maybe not, and then they walk away from one another. Now, I think that's not the best way to go about doing that. Instead, picture yourself walking up to that same person and saying, "Hi, I'm Dr. So-and-so. How are you today?" And the nurse looks up and says, "Oh, I'm fine. How are you?" "Great. What is your name?" So now you've established that nurse is not just the holder of information that you need, but rather is also a person. In addition, after they introduce themselves and you get their name, you can ask them, hey, is now an okay time to ask you some questions about Mr. Smith? Because again, you're recognizing that even though you need something from them, they might be in the middle of something, and having respect for the task that they're in the middle of goes a long way in establishing excellent interprofessional communications. And I can tell you this is absolutely accurate, having been a registered nurse myself prior to going back to medical school. And that leads into the next point, which is to recognize that you're part of a team. I don't care if you are super doctor 9000 who pumps out research papers all the time and is the chief of whatever department. It doesn't matter. Your ability to care for your patients will fall apart if the janitor doesn't show up to clean the hospital, if the security guard doesn't show up to keep us safe, if the nurses don't show up to implement the care that we prescribe, if the residents don't show up, if the scrub tech doesn't show up, if the guy that cleans the tools doesn't show up. So you are part of a team of which each one of those people is as invaluable as the next. So just keep that in mind as you progress in your education. And one of the other soft skills that's really important to develop is situational awareness. Now, this comes with time. This might be something like being aware that in the middle of a crisis in the operating room might not be the best time to ask if you can intubate a patient or if you can put a line in. You have to be able to read situations, know when to speak up, know when to just keep quiet and let the situation play out. And again, this is something that comes with time. Moving forward with some of those soft skills, I want to introduce an excellent analogy by Dr. Dustin Williams from Online MedEd. And it starts with the recognition that every interaction with every single person that you have in the hospital provides an opportunity to optimize the team that you're going to work with that day that has the common goal of caring for our patients. Now, most people understand that their behavior has consequences, in that when you interact with people, it can either be a positive or a negative interaction. And I like this analogy that Dr. Williams describes as those interactions being deposits and withdrawals. In other words, let's say you're having a good day and you run into one of your favorite pre-op nurses and you ask them, hey, how are you doing? How's your kids? And you chat them up. That's a positive interaction and can be considered a deposit in the emotional currency bank that you have with that particular person. Now, the smart clinician or the smart medical student will take advantage of all those opportunities, even when they're having great days, to build rapport and establish good team dynamics with people through positive or deposits in their emotional currency. And the reason being is that, number one, you do want to get to know some of the most interesting people you'll ever meet in the hospital, but recognize that you will have bad days, both as a medical student and attending, as a resident and as a person. And if you haven't capitalized on the opportunity to get to know your team members and to make as many emotional deposits as you can so that your currency is positive when you encounter that bad day, it's likely that you'll be written off as just another jerk doctor, another jerk medical student, since you haven't had the opportunity to demonstrate to those people that you're actually a pretty solid person. So, be aware to take advantage of any opportunity you can to get to know people. Ask about, their family, ask them where they're from, ask them how long they've worked there, get to know them. You might find that some of them will end up being good friends of yours outside the hospital. Let's walk through a day in the life of a medical student. So you show up and you're at some version of some parking structure, and on the way out of that parking structure, you run into a variety of faces that look like this. And if you're coming on daytime, this is nighttime crew getting off, and maybe they look a little tired. Now you can just ignore them as they walk by you, or you can say something nice and smile at them and say, hey, I hope you get some rest. Hope you had a good shift. As you're walking into this hospital, you usually see some form of this dude who's a security guard who stops you and says, hey, where the heck is your badge at? Now, instead of being annoyed by this guy, recognize that he's just doing his job. He's a person too. He might be the one guy who can do you a solid when you forget your badge, if you've taken the opportunity to get to know him, to say hi, to thank him, and smile. And this is somebody in particular I find that most people are just blind to. They just walk by this guy without saying anything. So be different. Say hi, ask him what his name is, smile. So now you're in the hospital and you get into the elevator and you find yourself juxtaposed next to some grumpy guy that you know from some other unit. Doesn't matter. Smile, ask him how he's doing. Make your way up to the operating room. When you get in the operating room, don't just beeline it over to the anesthesia machine and be that quiet mass vigilante who's just doing some unknown thing in the back. If somebody's in the room, like one of the operating room staff, walk over to them, shake their hand. Don't just shout from across the room who you are. Take the time to walk over there, shake their hand, ask them if you can write your name on the board. When you're done setting the room up, you make your way over to the PTU area where you find a vulnerable, nervous patient. One thing I like to emphasize to my medical students when we hang out is to always sit down when you're driving the conversation. Now, this can be difficult when you're in an area like this where there's not more than one chair. And if there is a chair in there, sometimes the family member is sitting there. I still will always go find a stool or something to sit on. The reason being is I find that standing over patients creates a weird power dynamic, and it makes the vulnerable feel even more so. So if you happen to be the one driving the conversation, sit down at the patient's eye level, give them the impression that their time is as important as everything else that you have to do. So as you move through the day, you might pass by the pharmacy window, again highlighting some of the unsung heroes of the operating room in caring for patients. Say hi to these guys, get to know them, ask them how their day is doing. Their role is critical in what we do in the operating room. And let's say now you brought the patient back and get them hooked up, except now the operating room has several more people. Once again, introduce yourself, say hi, offer to help. Do not just be a wallflower that stands there and while the nurse is trying to adjust the patient when they're in obvious need of an extra hand. Ask people how you can help and how you can be useful. So let's summarize some characteristics that make up a great medical student, at least in my mind. So yes, it's important to know your stuff by reading. However, this is so overly emphasized by medical students that they think this is the key to being a good medical student, and it's a very small portion of what really matters. What I can tell you is that even if you know your stuff, nobody wants to hang out with a know-it-all. No medical student knows the answer to every question, and those medical students, in the face of not knowing an answer and they start BSing, or make a negative impression in my mind. You want to be teachable. You want to understand that it's absolutely okay and encouraged to say, you know what, I'm not sure. A good medical student does far more than list off a bunch of facts that they've memorized. By saying I'm not sure, it demonstrates the humility associated with recognizing the limitation of your knowledge, but more importantly, it provides the opportunity to be taught by the person that you're hanging out with. Every day you want to be able to have knowledge gaps identified and have them filled by somebody who is more senior in you in that particular that particular field. And being comfortable with the concept of I don't know and knowing what you know for sure, it demonstrates what I think is a great medical student to hang out with. As mentioned previously, you want to be a team player. You want to ask people when they need help. Don't be a wallflower that just kind of sits in the corner quietly. Smile, introduce yourself to everybody that you work with, not just your resident you're attending. Show up early, like we talked about, 15 minutes early. Be prepared to stay late if there's something interesting that's happening. Situational awareness as discussed. And recognize that small things like please and thank you go a long way. So I want to briefly end by talking about a system for receiving feedback. Most medical students want to hear the opinion of how they did that day. And I want to provide a sort of a strategy on how to extract that information while at the same time protecting yourself from nebulous and vague, unhelpful feedback. So the first step, at least in my methodology, is to set the stage. You always want to pick the right place at the right time. This goes back to situational awareness. In the middle of a crisis, it might not be a good idea to tap your attending on the shoulder and ask for feedback on the day. Sometimes you just have to wait it out. Before you get started, explain your desire for your feedback. Say that, I'd really like to hear how I did today. I'm always looking for areas of improvement. When they get started, I like to take a piece of paper out and draw a line straight down the middle. And on this side, I write down a few key phrases of what it is that they're saying. And on this side, I write down things thoughts that came to my head during those particular things. And the reason I do this is I find that when people are listening without a piece of paper or something to keep track of what they're thinking, as the person starts saying something in the beginning, they might have a thought about that, and they become so preoccupied with wanting to remember what they said, they either stop listening to the rest of it, or they get so excited to share that they forget to do something critical, which we'll talk about momentarily. So you'll listen closely, you won't interrupt, you're going to display engaging body language, so you're going to look people in the eye. If you are using this method, you're just going to jot stuff down here, jot your thoughts down here as they're saying it. Then when you're done, you paraphrase back what that person said to you to demonstrate that you have listened effectively. And then you ask them did you hear accurately everything that they said? And if there was something that was missed, it gives them an opportunity to clarify. But more importantly, again, it demonstrates that you're a good listener. Once you have this list of feedback on your left-hand side, find some degree of truth in whatever they say, even if it seems super unfair or off the wall. If somebody just says, you know what, man, you really suck today, a response to that could be, earlier you said that I suck today, and I agree. I'm definitely not perfect, and I have a lot of learning to do early in my career. Can you give me some specific examples of areas that you want me to improve in? Now, this is the key when it comes to protecting yourself from vague, nebulous feedback that can feel personal at times. Somebody providing you feedback should be able to provide objective examples, or at least specific examples of areas they want you to improve on. And by requesting this, you can extract from the nebulous comments like, you suck today. Oh, can you give me some specific examples? Yeah, you were unprepared during the pre-op session. You didn't read about the patient's case, and you rushed the intubation. So now you have specific things that you can work on, and at the end of it, you can thank people for their time. So again, this is how I like to receive feedback. You can test it out and let me know how it works for you. So just some conclusions to think about. After everything that's been said, remember that anesthesia is pretty laid back. It's full of awesome people that are very easy to get along with. So some of this stuff seems kind of silly just to say out loud when I think of all my colleagues at work, because they're just so chill and they don't give people a hard time. They accept you as you are. This is especially true at UCLA. So this is my shameless plug of our residency program, which again, not only offers substantial clinical training, but the ability to have that in a collegial atmosphere full of very smart and very cool, very down-to-earth people, I think is very unique for us. Remember just to be yourself, because when you go to programs, it's true that you're there to show them why you're a good candidate for residency, but remember that we are also there to show you why we're worth your time and energy to train there, because choosing a residency program is one of the biggest life decisions you'll make. Have fun while you're there. Hanging out in the OR is a good time. Please reach out to me for any comments, questions, or concerns that you might have. Take care.